Welcome back, dear students. Today's topic of discussion is adrenergic receptors and drugs. So let's quickly recall of the previous class. In the previous class, we discussed about cholinergic receptors, that is muscarinic and nicotinic, and its various subtypes, that is M1, M2, M3, M4 and M5. Nicotinic is NM and NN, and for the various agonist and antagonist of each of the receptors. Now, in today's class, we are going to discuss about the sympathomimetic and sympatholytic drugs, that is adrenergic drugs, adrenergic agonist and adrenergic antagonist. In the last class, we discussed about parasympatholytic and parasympathomimetic drugs. So, this is the content slide. In this slide, the points that I have included are adrenergic system, synthesis, storage and release of catecholamines, classification of adrenergic receptors and drugs, characteristics of adrenergic receptors, sympathomimetic drugs, sympatholytic drugs, and reference of the pictures taken. So, in this adrenergic system, we are going to see that it is a transmission process which is mainly restricted towards the sympathetic division of the autonomic nervous system. Next point, it comprises of three mostly endogenous catecholamines. What are catecholamines? Non-adrenaline, adrenaline and dopamine. So these three comprise of the catecholamines. So what is non-adrenaline? It acts as a neurotransmitter at post-ganglionic sympathetic sites. So this is a neurotransmitter. Its location and site of release is post-ganglionic sympathetic sites. Next is adrenaline. It is secreted by adrenal medulla and may have a transmitter role in brain. So adrenaline is secreted by adrenal medulla and it has also a neurotransmitter role in brain. And the last catecholamine is the dopamine. This is very common to all of you. It is also a major neurotransmitter which is present in basal ganglia, limbic region, chemoreceptor trigger zone, anterior pituitary, and in a limited manner in the peripheral nerves as well. So, these three non-adrenaline, adrenaline and dopamine comprise of the catecholamines. On the right hand side, you all can see a picture. Here, this picture is highlighting that tyrosine, levodopa, dopamine, non-adrenaline, adrenaline means the release of the catecholamines. Its source is tyrosine. This is a presynaptic neuron and this is a postsynaptic neuron and this is the synaptic cleft, and this way these neurotransmitters are released. Next is the various synthesis, storage, release, uptake and metabolism of catecholamines. So catecholamine, here there is a schematic diagram where you can see the starting point is from phenylalanine which is occurring in liver and which forms the tyrosine. Then it forms the dopamine in the adrenergic neuron cytoplasm. Then it releases the dopa. Then it releases the non-adrenaline and then it releases the adrenaline. And here are the chemical structures and the various enzymes that helps in the secretion of this catecholamines. And previously I said these catecholamines have a role in neurotransmitter. So in the various schematic steps of this diagram on the right hand side depicts the synthesis of various catecholamines. Next is the classification of the adrenergic receptors and drugs. So what happens? This adrenergic receptor antagonists are divided to alpha receptor antagonist and beta receptor antagonist. This beta receptor is alpha receptor is non-selective, alpha 1 selective, alpha 2 selective, and this is non-selective, beta 1 selective, non-selective third generation, and beta 1 selective third generation. And the following drugs are given. So this is the basic introduction to various adrenergic receptors and its various antagonists and the corresponding drugs to receptors, specifically both selectively as well as non-selectively. Next, here I have shown the characteristics of the various adrenergic receptors, that is alpha 1, alpha 2, beta 1, beta 2, beta 3, based on location, selective agonist and selective antagonist. So by this time, dear students, you have got the idea that adrenergic receptors comprises of two major types, that is alpha and beta. Alpha is further subdivided to alpha 1, alpha 2, and beta is subdivided to beta 1, beta 2, beta 3. So location for alpha 1, it is present in the post-junctional on effector organs, alpha 2 pre-junctional on the nerve endings and also on the post-junctional brain pancreatic cell, beta 1 in heart, beta 2 in smooth muscles, or you can say blood vessels or bronchs, and beta 3 it is present in adipose tissue. These locations are a lifetime learning to all of you. This you should not forget. Next is the selective agonist. For alpha 1 it is phenylephrine, alpha 2 clonidine, beta 1 dobutamine, beta 2 salbutamol, and beta 3 is BRL 37344 complex. And selective antagonist is for alpha 1 is prazosin, alpha 2 is yohimbine, beta 1 is metoprolol, beta 2 is alpha methyl propanolol, and beta 3 is CGP 20712A complex. So this way, you all can understand that adrenergic receptor is divided to two types. It has got further subtypes alpha 1, alpha 2, beta 1, beta 2, beta 3 with its selective agonist and selective antagonist. Next is sympathomimetic action. Sympathomimetic action means this is the action present in drugs that are stimulant compounds which mimic the effects of endogenous agonists of the sympathetic nervous system. So previously, in the previous presentation, I said mimetic or mimetic means it is mimicking the action of the receptor. So here also, similarly for sympathomimetic action, it is mimicking the effects of endogenous agonists of the sympathetic nervous system. The primary endogenous agonists of the sympathetic nervous system are the catecholamines. You all know what are the catecholamines? Adrenaline, noradrenaline, and dopamine, which function as both neurotransmitters and hormones. So in this presentation, three heads up points we are getting. First, the sympathomimetic drugs means they are mimicking the actions of the receptors or endogenous to the agonist or showing a agonistic action. Second, it includes the various catecholamines. And third, these catecholamines act as both neurotransmitter as well as hormones. On the right hand side, I have provided you with some structure of this catecholamines so that you can see and remember that how these catecholamines are structured. So first is epinephrine, that is adrenaline, norepinephrine or noradrenaline, and dopamine. So epinephrine and norepinephrine are the other names of adrenaline and non-adrenaline. Next is the sympathomimetic drugs with certain examples I have shown here. So the sympathomimetic drugs are divided broadly into three types. That is, first is direct sympathomimetics, second is indirect sympathomimetics, and third is mixed action sympathomimetics. Now coming to the direct sympathomimetics. Here they are acting directly on alpha and beta receptors. So what are the examples? Adrenaline, non-adrenaline, isoprenaline, phenylnephrine. Indirect is they act on adrenergic receptors to release non-adrenaline, which then acts on the adrenoreceptors. That means there is an indirect effect on adrenoreceptors. Example, tryptamine, amphetamine. And third is mixed action sympathomimetics. They act directly as well as indirectly, such as dopamine and ephedrine. So dear students, in case of sympathomimetic drugs, it is very easy classification. But the main thing that you have to focus is you have to remember the names of the drugs and how its action is done, whether directly or indirectly or mixed both directly and indirectly. Next is the sympatholytic action. Dear students, the words may sound same, but the tailing of the word, that is mimetic, lytic, here comes the major difference. So now we are going to study about the sympatholytic action. So a sympatholytic or sympathopelagic drug is a medication that opposes the downstream effect of prostaganglionic nerve firing in effector organs innervated by the sympathetic nervous system. So what is saying? It is opposing the downstream action, means it is blocking the action or it is stopping the action, that is for the postganglionic release of the nerve firing. So now what is said, they are indicated for various functions. For example, they may be used as a hypertensives. They can also use to treat anxiety such as general anxiety or any kinds of panic disorder. So these sympatholytic drugs, they are basically opposing the function of the downstream activity. So thereby they are acting as a blocking agent or blockers, as I said in the previous presentation for parasympatholytic drugs. So here these drugs are mainly used for the various diseases like hypertension, anxiety, panic disorders. On the right hand side, you can see a picture that I have depicted. This is mainly focusing on the beta adrenergic receptor, that is beta antagonist. So beta antagonists are divided into three major types, that is non-selective, selective, and with alpha blocking capability, means the central activity, or you can say alpha beta activity. Here for non-selective, you see so many drugs are there like nadolol, propanolol, timolol, sotalol. For selective, you have atenolol, esmolol, metoprolol. And for both alpha and beta blocking activity, it is a common, that is labetalol, carvedilol, bucindol. So these are the various sympatholytic drugs acting on beta adrenergic receptors, being selective, non-selective, and with both alpha and beta blocking activity. Next, coming to the sympatholytic drugs or the blocking agent. So for alpha 1 blocking agent, it comprises of alpha 1 selective, that is prazosin, terazosin, doxazosin. So students, you can remember the name of the drugs of alpha 1 blockers ending with josin. You can see prazosin, terazosin, doxazosin, and for alpha 2 selective it is yohimbine. For beta 1 blocking agents or beta blocking agents, you can say the first generation non-selective is PST, that is propanolol, timolol and sotalol. So that is PST. Second generation of beta 1 selective is metoprolol, atenolol, esmolol. In short, you can remember as MAE. And third generation is LC, you can remember as labetalol and carvedilol. So dear students, in the beta blocking agents, I have given you the short forms. That short form is only for your learning. It is not meant to be written in the examination. This way, with the initial letters, you can remember the name of the drugs. Similarly, for alpha blocking agents, you can also do the same way. So this is the reference of the pictures that I have taken. So thank you students. Hope you all have understood the adrenergic receptors, the sympathomimetic and sympatholytic drugs. And very importantly, dear students, you have to remember the name of the drugs and the spelling of the drugs correctly. For any confusion and for any query, please feel free to ask, and hope this presentation will help you in doing your assignments. Thank you once again.